I'm Dr. Sheila Dyer, and I'm a naturopath working here in the Yorkville area in Toronto. Today I wanted to talk to you about menopause and its link with inflammation. So I was recently a participant in a webinar put on by Clinician Business Labs, and they brought Dr. Cheryl Burdett in to talk to us about redefining menopause as a condition of inflammation and oxidation. I wanted to tell you some of the take-home messages that I learned through that presentation. The number one thing that I learned was that your menopausal symptoms are not directly correlated to your level of estrogen. So the woman who has the lowest estrogen levels is not necessarily the woman who will have the most menopausal symptoms. In fact, it's the level of inflammation in the body that is more clearly correlated to how symptomatic a woman is going through menopause. The other thing that the presentation touched on was estrogen and cancer risk. So estrogen and cancer risk have been talked about largely since we have been prescribing hormone replacement therapy. And justifiably, a lot of women have been scared or not known what to think in terms of the risk of cancer. So one of the things that the presentation illustrates is that estrogen in itself doesn't cause cancer. If that was the case, we would have seen highest incidence of cancer when we have highest level of estrogen. So in the case of women, our highest levels of estrogen are seen when we're around 23. But we don't see the highest prevalence of cancer until women are in their 60s. So it's not as clear-cut as estrogen causes cancer. The presentation went on further to talk about the environment in which you put estrogen into. So we're talking about a healthy cell versus a cell that's been damaged by inflammation or free radicals. So if you put estrogen into a healthy cell, it will act very differently. Estrogen can turn on all of your antioxidant fighting power for you. So that in itself will decrease inflammation. But if you put estrogen into a damaged cell, it won't be able to turn on those antioxidants. And in fact, the estrogen itself will be damaged. And it's the damaged estrogen that happens to be metabolized a certain way that sets you up for cancer changes, or at least DNA damage. That is the first step in the cancer cascade. So that was really interesting, just how inflammation plays a role not only in your symptoms but also in your cancer risk. So what does this mean for you? What can you do about this? And what's really nice is that this means that fighting menopause or treating menopause really aligns with just having a clean and healthy lifestyle. So a lot of the things that you already know about healthy eating can now be played into treating your menopausal symptoms. So number one, go out and eat as many antioxidants as possible. So eat a huge variety of fruits and vegetables with lots of different colors. And then the other thing that I'll almost always suggest is a whole foods approach versus processed. I think you guys know that, but I'm here to just underline it for you. So if you're at home and you're dealing with menopausal symptoms, go check out my website at sheiladyrnd.com and maybe even book in for a free 15-minute consult so that I can outline an individualized approach to treating your menopausal symptoms. We'll use some herbs and we'll use some kick-ass diet advice. Okay, thanks.